Reverse pre-hypertension in 5 steps. Hello, I'm Dr. Rawat, a physician who studied nutrition at Harvard, founded healthgroupcoaching.com, and is currently writing a book titled Slow Aging, Reverse Disease, and Optimize Weight. Today, the video looks different. This is because I'm currently in New York in the basement of my twin brother's house. If your blood pressure consistently is above 120 for the top number or above 80 for the bottom number, then this is called pre-hypertension. If that top number goes above 130, that's called stage 1 hypertension. And if that bottom number goes above 85, that's also described as stage 1 diastolic hypertension. It is important to appreciate, however, that even small reductions in blood pressure can have quite a profound effect on reduction of risk of cardiovascular disease. So any reduction in blood pressure, which can be done safely without causing any symptoms of low blood pressure, are beneficial. Although in this video, we'll be talking primarily about diet, lifestyle, exercise, and supplements, it's also extremely important to appreciate that factors such as lack of sleep, disordered sleeping such as snoring, which is associated with obstructive sleep apnea, and chronic stress are also associated with raised blood pressure. And it is really important that factors such as poor sleep, disordered sleep, or chronic stress are also managed adequately in order to gain control over your blood pressure. This is a statement from the American Heart Association, and in this they state that trials have provided confirmation from various previous meta-analyses that a reduction in sodium, which is salt levels in the diet, lowers blood pressure in both patients with blood pressure as well as individuals who have normal blood pressure. And this has been associated with a statistically significant 20% reduction in risk of cardiovascular disease and strokes. It is noted here that a low sodium diet with a sodium intake of less than 1,500 milligrams per day can be achieved when higher sodium foods are replaced with lower sodium foods. It should be noted, however, that almost all sodium in the diet often comes from pre-made, pre-processed, ultra-processed food. Very few people will add so much sodium into their diet. And so it is important that you check the labels of food that you consume in order to be able to identify those foods which have higher sodium and need to be stopped. It has been demonstrated that increasing sodium or salt intake in the diet has direct effects on blood vessels. In this study, the association between salt intake and changes in uric acid, albumin, or protein excretion in the urine, which is the marker of kidney damage, was demonstrated, and it was shown that with an increased intake of sodium or salt, there were increases in SUA, which is serum uric acid, as well as UAE, which is urine albumin excretion. How effective is it to reduce sodium in the diet? In this study, restriction of salt in the diet was compared to single blockade of the angiotensin converting enzyme pathway with not restricting sodium and doing a double blockade with an ACE inhibitor as well as an ARB. And sodium restriction was in fact found to be more effective than dual blockade of the pathway. For any of you who are reducing sodium or salt in the diet, has been shown independently to reduce risk of cardiovascular outcomes. And sodium and potassium work like a seesaw effect. Reducing blood pressure is an effect of not just reducing sodium or salt, but also increasing potassium. And potassium has been shown independently to reduce risk of cardiovascular disease. In this study, for instance, increasing potassium intake was shown to reduce the risk of stroke by 24%. Apart from salt or sodium, are there any other foods which have a detrimental effect on blood pressure? Refined ultra-processed fructose, which is often found in fruit-based products, but not fruit itself. So fruit-based meaning fruit jams, fruit marmalades, fruit juices, fruit-based ice creams, or foods which contain high fructose corn syrup, which are often ultra-processed, factory-made long storage life food items have also been shown to be detrimental for blood pressure. In this study, it was shown that in clients in which fructose was substituted with other carbohydrates, there was a reduction in diastolic blood pressure and mean arterial pressure, although there did not appear to be a significant effect on systolic blood pressure. So what would be an ideal diet and lifestyle pattern for clients who have a tendency towards blood pressure? This is discussed here, and the main approaches are engaging in moderate physical activity, maintaining normal body weight, limiting alcohol consumption, reducing sodium or salt intake, maintaining adequate intake of potassium, and so consuming a diet rich in fruits, vegetables, low-fat dairy, and reduced saturated and total fat. In the case of dairy, personally, I tend to consume plentiful probiotic fermented dairy. So that would be yogurt, paneer, kefir, soft cottage cheeses, but tend to avoid dairy which is not fermented. So I avoid butter, ghee, and have also replaced my cow's milk with soya milk. This has multiple benefits, as I have discussed in previous videos on reversal of fatty liver, reversal of prediabetes, and reversal of PCOS. Soy isoflavonoids contain insulin resistance reducing effects. They reduce inflammation, they reduce cancer risk, and soya milk also contains fiber, which is deficient within cow's milk. Cow's milk naturally, unless it is skimmed, also contains saturated fat or cholesterol. And so overall, I like to consume fermented probiotic dairy and tend to replace the non-fermented, non-probiotic dairy with foods such as soya milk. Weight loss, along with sodium restriction, has also been demonstrated to reduce blood pressure. Of course, remember that weight loss would also have a beneficial impact in those clients who have a tendency towards snoring and perhaps have disordered sleep due to obstructive sleep apnea, and that would also have a beneficial effect on blood pressure. In this 6-month trial, weight loss and salt restriction was shown to reduce blood pressure in those clients who had high normal blood pressure. The diet which has the best evidence and has been most extensively researched for reduction of blood pressure is the DASH diet. DASH diet, along with salt reduction in the diet, has been demonstrated to reduce blood pressure. Exercise also has a beneficial effect on reducing blood pressure, and this is above and beyond the effects you would see with reduction in weight. In this meta-analysis, it was demonstrated that progressive resistance exercise had a beneficial effect on blood pressure. The reduction was minor. However, it's important to note that there was no increase in blood pressure, because exercise in the short term while you're exercising will have an effect of increasing your blood pressure, but the resting blood pressure when you're not exercising actually goes down. And so any people who are concerned that their blood pressure is high during exercise should know that this is expected, but the overall effect on blood pressure would be a positive one. Of course, if you have uncontrolled blood pressure, you should probably reduce blood pressure through other means first before you get onto progressive resistance exercise. There are various forms of exercise, of course, and which ones may be the most effective for reducing blood pressure. That was investigated in this study. And interestingly, isometric exercises, and these are exercises such as grip strength exercise or yoga, essentially exercises where the muscles are contracted, but the body does not move. So these are exercises where you maintain a certain body position, were found to have the best effect on reducing blood pressure. On this chart, you can see that the exercises which are more on that right side of the graph had a bigger effect in systolic or top blood pressure. You can see that aerobic exercises like walking, cycling, and running were compared to dynamic resistance training, to combined training, to high intensity interval training or HIIT, and isometric exercises. In this case, isometric hand grip, isometric leg extension, and also an isometric wall squat. And the isometric exercises were found to be the most effective for reducing systolic blood pressure. This chart here shows the effects they had on diastolic blood pressure. I would like to point out that all of these exercises were shown to reduce blood pressure, but the maximum was in those exercises where muscle contraction was maintained in a static body pose. And yoga would also be an example of this kind of exercise, which showed the best reduction in blood pressure. Here, I would also add that you can see that running also appears to be just as effective as isometric exercises. So these are all effective ways of reducing your blood pressure. With regards to the DASH diet or dietary approaches to stop hypertension, there are books you can read at the library, websites that you can visit. But essentially, a DASH diet emphasizes a healthy diet, increased consumption of fruits, vegetables, low-fat dairy products, whole intact grains, fish, nuts, poultry, and reduction in fats, red meats, sweets, and sugar-containing beverages. The total amount of fat, saturated fat, and cholesterol should be reduced, and levels of minerals such as potassium, calcium, magnesium, fiber, and protein should be increased. Increased blood pressure can lead to increased protein excretion in the urine. Often we'll measure this by measuring the ACR or albumin-creatinine ratio. Of course, bear in mind that ACR being increased is more relevant if the albumin is also increased in the urine. So if the urine macroscopy or urine chemical analysis shows protein in the urine, if the protein is not increased and the ACR is just increased because of a low creatinine, which is often a marker of low muscle mass, then that's not really a marker of kidney damage or ongoing kidney damage due to blood pressure or other metabolic issues such as sugar. There are people who wonder whether protein should be restricted in the diet when they are leaking protein from the urine. That is not the case, except in cases of late kidney failure where there is risk of uremia. Protein does not need to be reduced. In fact, if you're losing protein, then it is quite the opposite. As we saw in the previous slide, you need to increase your protein intake because, as we have seen with reversal of prediabetes and other metabolic problems, loss of muscle is implicated in insulin resistance and is also in itself an independent inflammatory factor as we get older called sarcopenia or muscle loss, along with other things which happen as we get older, including osteopenia or bone loss, osteoarthritis within the joints, as well as excessive fat accumulation as we get older. All of these things, along with other immune senescent factors, are the reasons that inflammation in the body goes up as we get older. I would like to highlight, however, that plant proteins are generally less inflammatory than mammalian proteins. So I would always prefer soybean, edamame, tofu, tempeh, lentils, legumes, beans, chickpeas, along with fish and lean white meats like chicken, poultry, eggs, and turkey over red meats, which contain mammalian inflammatory proteins. So I would certainly advise that foods such as beef, goat, lamb, and pork should be minimized and consumed infrequently. Good news is that there are certain foods which can be described as pleasurable foods, which can also have an effect in reducing blood pressure. And this is something we saw in the previous video on reversal of PCOS as well. This is a meta-analysis which investigated whether dark chocolate, and personally I tend to use 90% dark chocolate, has a reduction in blood pressure effect. And it did show that there was an effect which was superior to placebo in reducing blood pressure. This was a meta-analysis which confirmed that in those clients who are heavy drinkers, reducing alcohol to more moderate amounts will have a blood pressure reducing effect. But it has also been noted that alcohol in small amounts, such as a small glass of red wine once a day, has had a minor blood pressure reducing effect. There has been a recent study in which salt substitutes containing more potassium rather than sodium were shown to reduce blood pressure. This is an area which needs more research, but does appear promising. There is a product in the market called New Salt, and if you would like to buy this, then I will provide links to my product recommendation blogs in the description of this video. Bear in mind, however, that there is a real risk of increased potassium in the bloodstream, which can be damaging for the heart, particularly heart rhythm, in those clients who substitute sodium with potassium salts. And this is something that you should really do in conjunction with your physician, because I would recommend that you monitor your potassium levels if you are planning to substitute your normal sodium-based salt with a potassium-based salt, such as low salt. You have to be even more careful if you are taking certain medications which will in themselves increase your potassium levels. And these include blood pressure medications such as ARBs. And so these are commonly prescribed medications finishing with the artan, like losartan, candesartan, irbesartan, or ACE inhibitors. And so these are commonly prescribed blood pressure medications which finish with a pril. So that would commonly be ramipril, lisinopril, enalapril, as well as certain other medications which have both potassium raising as well as diuretic effect. And these would include medications such as spironolactone. If you're taking any of these medications, then generally speaking, I would not recommend that you replace sodium-based salt with potassium-based salt. And if you're not taking these medications, then it may be something you could consider in conjunction with your physician, because I would also recommend you monitor your potassium levels to make sure they don't go too high when you make that substitution. If you are able to tolerate that substitution, however, there is evidence that these will reduce your blood pressure. In this study, it was demonstrated that among persons who had a history of a stroke or were 60 years of age or older with high blood pressure, the rate of stroke, major cardiovascular events, and death from any cause was lower in those clients who substituted with a salt substitute rather than consuming regular salt. As we discussed earlier, reducing weight will have a beneficial effect on reducing blood pressure, not least because of the beneficial effects it will have on snoring and disordered sleep due to obstructive sleep apnea. Are there any approaches which are particularly beneficial as to how to lose weight apart from following a whole food diet similar to a low sodium DASH diet? This is a meta-analysis of time-restricted feeding and its effect on blood pressure, and it showed that there was a significant reduction in systolic or top number blood pressure in those clients who did time-restricted feeding, which is a mild form of intermittent fasting, on systolic or top blood pressure. Of course, time-restricted eating has beneficial hormonal effects as well as a calorie restriction effect, and a lot of this effect would have been due to the weight loss in itself. If you've been following my previous videos, there is a certain pattern of time-restricted feeding that I recommend, which is called early time-restricted feeding. This is eating in line with your hormones at a time when you're maximally insulin sensitive and not insulin resistant, at a time when your melatonin levels, which is a counter-regulatory hormone to insulin, is not high. So eating mostly in the daytime hours and less in the evening and nighttime hours. Also, I recommend some degree of chrononutrition. So consuming most of your carbs, which would be high quality carbs in the form of fruits and whole intact grains like brown rice, quinoa, millets, sourdough bread with flax seeds, and steel-cut oats with breakfast and with lunch, while having a low-carb meal in the evening. I also recommend a minimum of a 14-hour gap between breakfast and dinner. And so if you were to finish breakfast by 9 a.m., for example, you should not really be eating anything containing calories after 7 p.m. You could have zero-calorie drinks such as green tea, lemon water, or even diet sodas or zero-calorie juices. But those clients who want to reverse disease would often have to fast for longer. And so this might be for 16 hours, so finishing dinner by 5 p.m., or even 18 hours, finishing dinner by 3 p.m. Personally, for myself, when I lost 12 kilograms or 26 pounds in weight over a 12-week period, I was fasting 4 to 5 days a week for on average 16 to 18 hours a day using this method. But this would be varying for different people and would also depend on various other parameters, including your diet quality, your amount of exercise, also other factors including sleep, stress levels, etc. So what are the 5 steps that you need to take to start reducing your blood pressure or prevent a rise in blood pressure as you get older? On this graph here, the effect size of all of these can also be seen. Step number 1 is to reduce weight and maintain a normal body weight, a body mass index of between 18.5 and 24.9. This would have the effect of reducing your blood pressure from 5 to 20 millimeters of mercury per 10 kilogram of weight loss. The second would be to adopt a healthy eating plan, such as a low sodium DASH diet, so a diet rich in fruits, vegetables, low-fat dairy, and reduced content of saturated and total fats. As I had discussed before, I tend to consume fermented and probiotic dairy such as yogurt, kefir, paneer, soft cottage cheeses, but tend to replace the non-fermented and non-probiotic dairy such as high-fat containing cow's milk, butter, ghee with other food items such as soya milk. Step number 3 would be to reduce your sodium intake and try to cap that at 100 millimoles per day. This would have an effect of reducing your blood pressure by 2 to 8 millimeters of mercury. Step number 4 is to increase your physical activity such as walking, running, and as we saw in the study, particularly isometric exercises such as yoga. This would have an effect of reducing blood pressure by 4 to 9 millimeters of mercury, and also limit consumption. And I would recommend maximum 1 small glass of wine per night. And this can have a modest reduction in blood pressure effect of 2 to 4 millimeters of mercury. Every other month, I run a coaching program on my website, healthgroupcoaching.com, which consists of 8 one-hour classes on Zoom video, which take place twice a week over a 4-week period. The mission on healthgroupcoaching.com is to slow aging, reverse disease, and optimize weight. The topics we discuss on the program include causes of metabolic disease, obesity, and how to reverse them, including a lifestyle prescription, which I email to all my clients, circadian or hormonal time-restricted feeding, optimizing nutrition leverage to reverse disease, an anti-inflammatory diet to slow aging, gut microbiome reset to optimize metabolism, sleep and stress management, exercise and resistance training, as well as supplements to slow skin aging and reverse disease. On the website, I also have a product recommendation section where I go through various kinds of products which I recommend for various conditions, and I will leave a link to the product recommendation section in the description of this video. I hope you found the video useful. If you did, then please remember to like it, subscribe to the channel, share it with someone who perhaps has borderline raised blood pressure. If you're interested in reversal of prediabetes or reversal of fatty liver, then click on the videos for that, and I'll see you at the next video.